back. We are pivoting to H96, which, if you recall, was the House bill on increasing monetary thresholds for a certificate of need. And it has come back over on this from the Senate and is on notice current on today's calendar, I believe. So we're going to look at their proposals of amendment.
Right, great. Jen Kirby, Office of Legislative Counsel. I am going to put up a markup version showing the changes that the Senate proposed to what you passed. So again, this is an act relating to the increasing the monetary thresholds for certificates of need. The first change looks big, but is not, because you aligned the monetary thresholds for hospitals and non-hospitals. We took out the reference to a healthcare facility other than a hospital and then deleted the whole subsection on hospitals. So everybody has the same thresholds. We also, they struck the specific item for construction, development, purchase, lease, or other establishment of an ambulatory surgical center. You had had a threshold in there that put it at the same as other facilities. So we just folded them in with this all facilities. So now it's just one statutory provision that has the monetary thresholds for all healthcare facilities, except those that are excluded in the exclusions section.
So we're certain that ambulatory surgical care centers are under statute.
Definition of it, yes, they are. Yep, they're listed. Yep. Up if you want, but because they are.
They made no changes whatsoever to any of our monetary thresholds. They just, because we had set the thresholds same way for non-hospital and hospital, they just got rid of and just made it facility.
Exactly. And some of that was my suggestion and the board's, that it would make sense to just combine those two. So
Great.
Just triple checking the ambulatory surgical center definition is in here. I think both the center. Yes, it is in. It is defined. And yes, and it is in the definition of healthcare facility. So I will show you those two pieces just so we can all be having the same information. So in the subchapter on certificate of need, which is health facility planning, in the definitions, first there's a definition of ambulatory surgical center, came first because alphabetical. And then in the definition of healthcare facility, there's a large definition that includes different types of, including ambulatory care, and then has a list of, in subdivision B, part of what's included includes down here at the end, any inpatient or ambulatory surgical diagnostic or treatment center. So,
Thank you.
yeah. Wanted to make sure I was giving you the right information. All right, so now let's put back up the rest of the language. So that was the looks big, but was really non-substantive change. So again, striking out the specific provision around ambulatory surgical centers because they'll fall under the regular healthcare facility provisions, and then deleting all of or repealing all of subsection B because the financial thresholds were aligned and the rest of the provisions were present in both. They did not make any changes to your increase for the monetary threshold for the conceptual development phase certificate of need requirement. Any other changes in that piece? For exclusions, they didn't change any of the ones that you had put in, but they did add back in the concept of an exclusion for projects and services that are owned or operated by the state or funded in whole or substantial part by a contractor grant awarded by the state. But then they added, provided, however, that the state agency sponsoring the project or awarding the contractor grant shall inform the Green Mountain Care Board prior to commencing the project or within 30 days following the execution of the contractor grant. So that way there's notice going to the Green Mountain Care Board, but because another part of state government had already approved the project, there was no CON requirement.
Leslie, I was just curious to know what
what notice doesn't give any sort of need of action or.
Right, it was making them aware.
So what's the point of that?
I think so that the board has an awareness of all of the projects and services that are coming online in the state.
So system-wide view of.
Right, that's
Whatever.
that's my expectation. I don't know if the board has a different take, but, the purpose of notice about a state project is to keep the board informed of new projects, new services coming online in the state for a system-wide perspective.
I wouldn't dare to answer that.
I'm sorry?
I wouldn't dare to answer that.
Oh.
Unless I have a knowledge background.
That was my understanding is sort of the compromise or consensus version from various parties.
I hate to amend anything.
I know, I'm suffering here.
Do we want to state like to informing the Green Mountain Care Board prior to commencing the project or within 30 days following the exit to ensure that it aligns with the statewide healthcare delivery
I
plan?
think until that exists,
If enacted.
Problem.
I mean, I don't think, I think you would need to build in substantive requirements that anything
Yeah.
awarded by any portion of the state must align with that if you're going to have the board reviewing for that purpose. I think my understanding was that that some of this was to honor work done by other parts of state government, to not have the board reviewing, sort of double reviewing projects that had been approved by another part of state government, but continuing to keep them aware of what's happening.
So that the board can incorporate that into their system of care. Mari?
It'd be okay leaving it as is, and if we do want the Green Mountain Care Board to have more oversight and authority over state projects, then we can do that elsewhere outside of the certificate of need
Yeah.
process.
Couldn't we incorporate something like this into S-126 if we really needed to and just let this be?
Let this be, and then maybe in our statewide delivery plan, make mention of something around statewide projects. Is that I didn't know if you were just waving at us or.
She's the queen, it's okay.
I was gonna text Laura, our legal counsel, Mr. Coalition. He said he would go amendment, because it's referred to on page 96. To see what could give us a motion.
She had an amendment to this as well.
She doesn't have an amendment. She has a suggestion that any statewide project, at least the Green Mountain Care Board is looking on whether or not it fits into our system of care.
Or how it.
Or how it fits into the system of care.
Thank you, Madam
So
Chair.
maybe that would be best addressed in 126.
Probably, and I think if, going forward, if you want to try to combine these in some way or have them refer
Yeah,
to each other, you can.
okay,
I'm sorry,
go ahead.
is there a part of S-126 where this kind of policy change could be fit already, or would it require us adding a new section to the bill?
It would depend on what you were looking to do.
Okay.
But the point is, we can use that vehicle if we need to. We don't have to make this, we don't have to do it in this bill.
Yeah.
Okay.
Any other discussions on what the Senate did?
But yet, the other change, it's the effective date, fairly minor. But there was interest in, I think from all of the parties, in moving the effective dates, not from July 1st to on passage. And then we have the same, for applications already in process on that earlier date, slightly earlier date. If there's interested party status, the application keeps going. If there's no interested party status that has been granted, then the applicant can withdraw.
Okay. Any questions on the Senate proposal of amendment?
The straw poll, right?
This is thoughtful. And Mari, so this is up for action tomorrow. Yeah, okay.
So we can't stay out too late tonight, Woody?
Yes, it's a school.
All right, so, all those in favor of accepting the Senate's proposal of amendment? On a straw poll of
Can't see.
10-01.
Oh, sorry.
Yeah, you
Oh.
couldn't see because the screen
Oh, I'm
was,
sorry.
yeah, so now that people
Okay.
can see, you can wave like a queen.
10-01. Thank you, everyone. All right, let's go back to 126. Hey.
Oh. I'm tired.
Are we planning to take a break at noon or are we gonna work through lunch today?
We're gonna take a break.
Okay, just checking.
Okay, so we were looking at this, brief kind of reverse deal and this notification about a proposed reduction or elimination. And I realized, looking at this as well, that it's a hospital proposes to reduce or eliminate a service in order to comply with a budget established under this section. Don't thank you. And so, that's also why it is here in this part of the statute. But we could pull it out and put it somewhere else if we wanted it somewhere else. So the notice, we talked about having notice also sent to communities within the affected hospital service area. And then the language says that the notice must explain the rationale for the proposed reduction or elimination and how it is consistent with the statewide healthcare delivery plan and the hospital's most recent community needs assessment. Allows the board to evaluate the proposed, but does not require the proposed reduction or elimination for consistency with the plan and the community health needs assessment, and allows it to modify the hospital's budget or take such additional actions as the board deems appropriate to preserve access to necessary services. And then it does say if a service is identified for reduction or elimination in connection with the transformation efforts undertaken by board and the Agency of Human Services, it does not need to comply with that this requirement.
So if AHS and the board have determined that you shall not have this service and they say we're gonna eliminate the service, they don't need to go through.
Right, then they don't need to provide notice of intent to the board, AHS, healthcare advocate, legislators.
But what about community, what about legislators in the community? I have a big question mark there.
Yeah, hold on, Leslie, Brian has a question. Brian?
Yeah. If a service was identified for consolidation, like for example, like if in a region, multiple sites are providing a service and it's recommended that it be consolidated into one site, would that be considered a reduction or an elimination if it wasn't actually reducing the access to the service, it's just changing the way it's delivered?
If you could make an argument either way.
Okay. I don't want to, but I'm just curious.
Leslie,
I guess I was wondering why the community would need to know about a reduction or elimination of service. I mean, I imagine the healthcare advocate and all those people are involved in this process, but not the community.
well, presumably AHS and the board would have already identified that the service needed to be eliminated and that would be communicated in some way.
Well, maybe.
We noticed to the community is something you're adding, so it wasn't in what came over. So if you wanted to add something in D to be consistent with that, you certainly could. Or you could hear from the board and AHS about what their process is for proposed transformation efforts. I don't know. I mean, in this case, we're talking about specifically a reduction to comply with a budget order.
And I'm not sure it's the hospital's job to notify the public that the board or AHS has cut their services. So I think that's somebody else's job.
Well, then whose job is it if the board decides, just speaking off the top, to cut a dialysis center? Because it's over, we're have too many. I'm just making this
Yeah.
up. But whose job is it to inform the community then?
Well, it's their job to inform the efforts that they're making in the statewide healthcare delivery. And Act 167. Lori?
I'm gonna say something that's probably slightly controversial, but do it anyway.
That's fun.
I completely understand the need to alert our community. I think that is something that the media should be doing. And I think hospitals and providers do it for their patients. But I also think if we put in statute how a community has to be, or that they even have to be notified, we will never get to the point where we have a right-sized healthcare system that we can afford. I'm sorry, things will close. And they will either close because we do it in a planned, intentional effort, or they will close because they blow up. And then there's no plan, and it's worse off for our communities. So I just want us to be really careful of what we're putting in statute to ensure we're not like saying we want right size or whatever we're calling it over here, but then preventing every way of doing it over here.
Thanks for saying the quiet part out loud. Thank you. Brian? Did you have your hand up?
No, although I had a
If
question.
you didn't, then I'm
Yeah, no,
going
I
to
have a
Daisy.
question, but.
I thought I saw your hand.
No, I was just scratching my head.
I thought what Lori was gonna say was what I was thinking, which is, can or should we be mandating what these businesses have the right to communicate or not communicate, right? Like they're independent entities, they're nonprofit businesses. They're not mandated to provide these services. So if they're going to cut them, like if a hospital is going to cut their obstetrics unit because it's not profitable for them to operate their business or that service line anymore, why should we force them to communicate that to the community? It would be good for the community's, knowledge to know that, yes, but I don't know that we should mandate what a independent business is doing for their community.
Woody?
I would disagree with that. I think, say for instance, I'm just going to give an example. If a business closes, isn't there a requirement that the Department of Labor,
Yes.
the executive level of government be notified, so that, services can be brought in to help the community?
Only under certain guidelines.
True.
And that's based upon, those guidelines have to do with unemployment and if you're putting a certain amount of people out of work. And we also have in here, so that's the Department of Labor. They don't have an obligation to, like when Global Foundries decides to lay off 400 people, they don't have an obligation as a private corporation to notify the public. They do, the Department of Labor, and in here we have that they must notify the healthcare advocate, who, by this way, represents the public, the Green Mountain Care Board, and the Agency of Human Services. So I think actually it's quite analogous to what we do when you're closing other things that affect labor, then we require that you notify the Department of Labor. Topper, did you have a question? No, it's a great example. I think it's analogous to what we already have in here. No question? Okay, I'm sorry, I thought I saw your hand up. Leslie and Brian?
Well, I guess I'm misunderstanding or maybe reading, because we're not asking hospitals to do anything here in D. It's a result of transformation efforts, which is what we should be doing. And of course we should be doing. And who knows what the downstream effects might be of transformation efforts. The only question is, should the community learn about a change in service that has been determined by the board or AHS, not by the hospital. It's a different process. It's not, so I'm certainly not gonna spend a lot of time on this, but I just think that there are different buckets, let's say, of change in a community's health landscape. One is gonna come from the hospital, one's gonna come from finance, one's may come from transformation. I'm not sure that there should be different processes for each of them.
So this is 2D. So 2 starts with if a hospital proposes to eliminate or reduce a service, these are the things that they have to do. So 2A, they have to notify the board, AHS, and ACA.
Okay,
And
so.
the General Assembly. And then it says what that notice should be.
Okay,
And then it says that the board can take their notice and do stuff with it. And then it's saying, except for things that the board already or AHS already told them to eliminate, they don't have to do that. So we are still talking about the hospital here.
get it, Ms. Reddick, yep.
Brian,
So, a difference I see between this and like a military contractor closing in a community is that I don't think healthcare should be treated as a commodity. I think we should be treating it as a public asset and a public good. So it should fall under a higher level of protection or education. And a question I had earlier when I was scratching my head that you read my mind was that I'll ask now was because when Lori mentioned being concerned about slowing things down, I am concerned about that. What I don't understand is how this would slow it down. Like how would the notification slow it down?
So in my opinion, let's say a hospital, because there is pressure right now in hospital to cut costs. Let's say they were going to eliminate the urology department, right? And a notice went out to the community that they were proposed in their budget to eliminate the urology. The community, who may not even be urology patients, will send letters, advocate to keep it open, and there will be pressure for the hospital not to make that change. Right? And then what do they do? If they feel it's in their best interest and the community's best interest to have a viable hospital without urology, and those patients are going to be notified and will be given a new provider and will have a treatment plan transition, right? Like that's what they do today. I just think we are making it much harder for hospitals and providers to do the necessary work they need to do for us to have a viable and more affordable healthcare system. It's just like schools. We just closed a school in our community, right? There was such outpouring against closing the school. The school board almost changed their mind, but that would have meant $6 million increase in our budget, right? And so they did the hard thing, but we're setting people up for failure of what we're trying to do.
So what I'm hearing, and I'm done with this, is that in our effort, we have to balance public engagement with regulatory barriers, and that this could create a barrier that would be expensive and have no benefits because it would delay an inevitable process, cause emotional harm to people and financial harm for no good outcome. It reminds me of like how Act 250 gets messed up sometimes. So I see your point.
Totally.
Yeah, I see your point. But I still think we need to figure out the notification somehow.
I have Mari and then I have Woody.
This is hard because I understand that rationale, but I also don't like, and I'm not saying you're saying this, but this is how it feels to me, the public being relegated to being an annoyance and a potential hindrance instead of being the rightful, having the right to know when something is going to impact their community. And yes, then it might mean that school boards in that situation or other entities are going to still have to make really hard decisions, but I don't want to silence public voices, especially since I think using hospitals as yes, they're private and nonprofit in Vermont, but they're using public dollars and they're part of a statewide healthcare system. So it's different than Global Foundry or another private business in Vermont. It's really different than that. So but those are the two areas where I object to not having public notice.
I'm just gonna say that if a hospital makes a cut to comply with a budget order, the public is going to know about that, and the public is going to come and have outrage. And it is the hospital and the Green Mountain Care Board and the Agency of Human Services. It is their job to explain to the public why this is happening. Just like Act 167 and the Wyman Report. They did a massive tour around the state to react to the public outcry. And it is for them to justify why this is happening. We're not saying that there won't be public notification. It's not like we're saying you should hide it from the public. We're just not putting in statute the mechanism of which they need to notify the public.
Are you speaking specifically about D right now?
I'm talking about
I'm
the
talking about-
conversation, no, I'm talking about the conversation we're having right now about D. That,
Mine's broader than D.
okay,
I don't have an issue with D.
I will say mine's broader than D too. Right, and so, and I just want to say, that's not what I'm trying to say.
I know
at
you're
all.
not. I know you're not.
And patients do get notified and word will get out. How do we weigh this? I'm done.
Okay. So I'm gonna suggest, does anyone have any suggestions around the rest of 2D other than the public?
D, is that what you're asking?
2A through D.
So I just want to flag for your, further thinking whether there's anything different you want to do around the timing, if there's, a provider who, or an individual who provides a service who leaves or retires or something, where the 90 days may not be practicable. And the proposal from Buzz was to carve them out, add them into D for a service that is reduced or eliminated due to lack of staffing, other forces outside of hospital control. Now I will say this is, again, if it's proposed to be reduced or eliminated to comply with the budget order, so it may not need to be addressed in here if it's not to respond to the budget order. But I did want to just check in to see where you are on the 90 days and whether you want to do anything different or whether if it's just limited to responding to a budget order or complying with a budget established by the Green Mountain Care Board.
Okay. So actually, thanks for flagging that. So their concern around, we may have to close things for other reasons. That's not covered in this.
That's not, right,
And
based on the actual language in here, no. I think, we've been talking about it in sort of broad terms, but going back to the language on in this subdivision, it's really for a hospital that proposes to reduce or eliminate to comply with the budget rule.
okay. So we would not need their language around a service that has been reduced or eliminated due to lack of staffing, other forces outside of hospital control. We wouldn't need that.
That doesn't seem relevant if it's not to comply
with the budget.
in order to comply with the budget order. I don't know if we want to hear from this thing.
Kevin, would you like to say something? You're not even putting your hand up.
Jen Green from Buzz, I understand what Jen is saying, I think it's just clarifying. In case the timing is, like, it's just a clarification, it's kind of belts and suspenders, I would say.
I'm actually concerned about the language reduced or eliminated due to lack of staffing. Because I think that could be interpreted, or that could be a justification for closing anything.
In this current
In
workforce situation,
current
yeah.
workforce. So for example, you would not have to provide notification for closing inpatient beds in a hospital psychiatric unit because you don't have the staffing for it. So therefore, there would have been no notification.
If we want to keep it at the, for purposes of meeting the budget, that's fine.
I think we should keep it as is.
Where do you see lack of staff?
Yeah, I don't see that in.
It was in Bob's proposal.
Oh.
Dr. Lefler had brought that up as a concern. But this is because they are closing things to comply with a budget order. So therefore, that wouldn't apply. Okay. Do we want to talk about 14 days instead of 90 day? If it's again has to do with a hospital budget order, I am inclined to stick with 90 days. It's not an emergent thing that they have to reduce the service because of staffing or something like that. So therefore, why does it need to be 90 days or less than 90 days? Gavin?
Devin from Buds, I would say because we get our budget orders, you know, we hear them verbally on September 15th, we get them October 1st. Our budgets start on October 1st. So basically, if at that point we said we're cutting the service, the savings wouldn't be realized until after the first quarter. So we would probably have to cut more of that. It's just the budget is 1 year long and 90 days is a very large chunk of it. So I realized 14, I was talking to Michael, 14 days is fast. You know, I'd love to talk to the Green Mountain Care Board about some sort of timeframe that might work for both of us. About 60. 45.
I was gonna say. Bargaining days now. 45 minutes right before Thanksgiving, and you know, everybody goes on vacation at Thanksgiving.
Meeting from the board.
Yeah, let's hear from the board on it. So you're gonna talk with Michael and you'll come up with a date? You guys make the bargain, not, okay. 15 days seems a little short. Okay.
Do you want to finish with this section or you want to be done?
How many other things?
There's number 3 on here. And then just remembering.
One more.
There's a couple on the back.
3.
45.
Yeah, but they'll just
Yeah,
remember
they're trivial.
existing.
Yeah, but just so we.
All right, so this, I think we can finish up 3.
Okay, so 3 requires the board in collaboration with DFR to monitor the implementation of any authorized decrease in hospital services to determine its benefits to Vermonters or to Vermont's healthcare system or both. I think this had originally been proposed maybe by VAS, similar to their language in their proposal about looking at having a reduction in health insurance premium growth. I think my recollection is that the Senate committee or perhaps other witnesses were concerned about just expecting that there might be other reasons why there was a decrease in hospital services, not just to reduce health insurance premiums. And so that's why the language is broader.
Okay.
And we can think about this, get back to it after.
Does anyone have an issue with it?
I haven't.
Okay, go ahead.
I have an issue. I have a question is what's the role of DFR in?
I think in case there are health insurance premium decreases and
Oh, you
and it
probably
may have
just said
been an
that, but-
earlier version. So if you don't feel like it's necessary for them to collaborate with DFR, or you want to add AHS or something else, we can do that.
Has DFR weighed in on this?
I believe DFR did when they came in, and let's not forget, DFR regulates insurers. Even though the board regulates their rates, DFR is the one that, yeah, go ahead, Michael.
board, DFR regulates certain fields, so they regulate teachers, stuff like that, so it's not all the board.
All right, well, we'll come back to it after lunch. Are we back here at 1 o'clock?
No, you have to.
No, after floor.
Oh, after Flora, I forgot about Flora.
It's not gonna be short either.
It's an hour, I think.
No, okay.
Sorry, that's the end.
For an hour and a half on your invitation.
Yeah. So we are back here 15 minutes after the floor. And we'll be going till at least 5 o'clock today.
And we